Hi, my name is Charnel, and here I have Sherilyn, my volunteer, and I'll be demonstrating a deep tendon reflex assessment for Nightingale College. Sherilyn, do you agree to participate in this demonstration, as well as being recorded for educational purposes that will be reviewed and graded by faculty?
Yes, I do consent to the demonstration and recordings.
Okay, so I'm going to go ahead and wash my hands, apply gloves, and gather my supplies. I'm going to enter my patient's room, provide privacy by either closing the door or the curtain, and introduce myself to my patient. So Sherilyn, my name is Charnel. I'll be your nurse today. Could I have you verify your first and last name and date of birth, please?
Sherilyn Silas, February 8, 1962.
Okay, and so today we're going to be doing a deep tendon reflex assessment. This assessment is most important, especially if you're pregnant. So in pregnancy, there's the chances of having preeclampsia, eclampsia, and then if you're given magnesium, we're looking for toxicity. And so what we're going to be doing is we're going to be tapping various tendons on the body, and we're looking for a tendon reflex. And so this is graded from a 0 to 4 scale, 0 being absent, a +1 being hyporeflexive, a +2 being a normal reaction, and a +3 being a hyper reflexive reaction, and then +4 being hyporeflexive or clonus. So that 3, 4, if you're pregnant, is signs of eclampsia. Whereas a 0 and a +1, if you are taking magnesium, could be an indicator for toxicity. Okay, so with this assessment, it's done bilaterally. Just for this video purposes, we're going to do one side. So we're going to start with the bicep, and we just want you to keep your arm relaxed. We're going to find the bicep tendon just right here at the bend of the elbow. And when tapping that, we're looking for a contraction of that bicep, and then there will sometimes be a flexion of the forearm. We're going to go ahead and tap that area. And then we're going to check the tricep. So with the tricep, we want to support the arm. We want it to be relaxed and dangle. We're looking for a contraction of the tricep, and then there will sometimes be like that flexion of or extension of the arm. So right above the elbow, we're going to tap, and then we're going to see that contraction as well as that flexion. Okay, and then we're going to go on down to the patellar. So right below the kneecap, we're going to find our patellar area where we're going to tap. This we're going to be seeing a extension of the leg when we tap it. And then next we're going to check the Achilles. So right behind the ankle, above the heel, is the Achilles tendon. So we're going to dorsiflex our foot, and then the reaction that we're going to be seeing is a plantar flexion. Okay. And then next lastly we're going to check for the clonus. So for the clonus, we want to dorsiflex. And if nothing is present, then we don't have clonus present. But when we dorsiflex and we're seeing that jerking or rhythmic tapping like 4 to 5 times in a row, that could be an indication for clonus. And so you want to do that. If you don't see anything, then good. If there is that reaction, then clonus is present. So then once we're done, I'm going to go ahead and perform hand hygiene and document my assessment. Thank you.